Hello, everyone, and a very warm welcome to all of our audience here. It's wonderful to see so many of you are joining to this webinar itself today across the UK. My name is actually Mohammed Nawaz, and I'll be your moderator for today's session. We're absolutely delighted to have you here for what I know is going to be an incredible webinar, which could be a very in-depth value to you when it comes to choosing your career. Whether you are just starting to explore a career in adult social care or you're looking to take that next step in your future or your journey, you're in exactly the right place. Before we dive in, let me quickly check, can everyone hear me clearly? So if you can hear me clearly, could you at least put a hands up, raise a hand, or put an emoji as well? Yes, if anyone could clearly hear me, could you actually raise your hand? Yes, if so, brilliant. That's great. So now I can see we have people joining into this webinar. So from all sorts of backgrounds today. Some of you might be considering a complete career change. Others might already have some experience in this industry as well. And some of you are just beginning to explore what this sector has to offer, right? No matter where you are in your journey, today's session is designed with you to ensure you get the proper value in this industry. So regarding about South London College, I'll just like to give you a small insight, a small brief about what South London College is. So before we jump into the main content of this webinar, I want to take just a few moments to introduce you to what South London College is about. So before knowing who we are and what we stand for, we'll give you a confidence in the qualification and support we offer. Right, so South London College is a leading provider of professional qualifications in health and social care. What makes us special, we're absolutely dedicated to preparing students, not just to pass exams, but to build rewarding, sustainable careers in the care sector. Our programs combine theoretical knowledge with hands-on practical training. Because we know that in care, it's not just about what you know, it's about what you can do and how can you make a real difference in people's lives. We work closely with employers across the sector, so our courses are designed to meet actual industry standards and employer expectations. That means when you complete your qualification with us, you're not just earning a certificate, but also you're earning skills that are tailor-made to the industry as well. And I have to mention, we have a fantastic range of course based on different levels, from the beginners to the more advanced, from complete beginners to all the way from advanced as mentioned. So whatever stage you are at, we can support your growth. If you like to explore more about us, you can visit www.southlondoncollege.org, and we will share that link again at the end of the webinar itself. So getting in, what we will actually cover today. So what is going to be actually today's agenda of this webinar. So, okay, we'll be talking about why adult social care is very important, the essential skills that you need to actually obtain in order to get into the care industry. Also, what type of CV you need to prep. All is going to actually be discussed in the webinar itself. What are the qualifications that actually you need to get into? Also, interview success, how you actually have to interact yourself with employers, and what type of skill sets you require in order to pass the interview very successfully. And also top 10 interview questions will actually also be discussed in the webinar itself. So we're going to actually, we have a special guest here who is going to actually talk you through about this industry. She's a well-versed person in the industry itself with decades of experience. And having an expert in this webinar will actually help you to make the better decision in your career. So now I'm absolutely delighted to introduce you to to today's expert tutor. And when I tell you about her background, you will understand why we are so privileged to have her with us. Please welcome Mr. Sandie Bowden. Dr. Bowden is a highly experienced trained nurse with an incredible depth of knowledge across some of the most crucial areas of care. Her background includes district nursing, care of chronic and terminal ill patients, and rehabilitation, all absolutely critical areas within adult social care. But here's what really sets Dr. Bowden apart. Since the year 2000, she has been lecturing on nursing, healthcare, leaderships, and management courses. That's over 2 decades of teaching experience, helping thousands of students just like you to build successful careers in this sector. She's also an experienced NVQ assessor in health and social care and a subject specialist in health and social care, psychology, and leadership. So you are really learning from someone who's understood this field very well. Clinical practices, assessment standards, and what it actually takes to succeed and progress in your career. Dr. Bowden, thank you very much again for attending this webinar. Very highly thank you on behalf of South London College. We are excellent. We have an excellent person in today's webinar to actually guide you on what type of steps you need to take in order to have a proper lucrative career in the care industry. So without any further ado, I would like to provide Dr. Bowden the webinar, and yes, you can proceed with.
Thank you for that introduction. That was really special, and welcome everybody to this webinar. I hope that you'll take away lots of food for thought, and it will help you decide whether adult social care is the right career path for you. So before we kick off on these statistics and information, I would just like to say that working in adult social care is such a rewarding career, whichever sector you choose within the main sector, you will find rewards beyond belief. There can be no better thing than to help another human being achieve their goals, get well, help them to achieve, it might be small goals, just such as being able to dress themselves or being able to take their own medication. And you will find that within any element of health and social care, these rewards will bounce back into your life and give you a sense of satisfaction. Now, some of you may already have embarked upon a social care career, others might be thinking about it. So hopefully this webinar will provide you with some information and some idea of how to go about the first rung on the ladder, as it were. So you can see some statistics on the first slide here. But what I want to do is go through some additional statistics with you and some information. Now, from the Office for National Statistics in England and Wales, we have these following statistics. So the UK population is ageing, with a growing proportion of people over 65 and a decreasing proportion of those under 20. So between 2011 and 2021, the number of people aged 65 and over in England and Wales increased by over 1.8 million. So I'll just let that statistic sink in a little bit, 1.8 million. While the median or middle value age has risen from 39.6 years to 40.7 years. So this shows us how the population is aging. It's the fastest growing segment of the population is those over 80 years, and projections suggest that this trend is set to continue. Now, that isn't to say that as we age, we do get more and more frail or sicker, because obviously people are fitter. Lots of people are working even into their 80s. There was one media story about an 85-year-old healthcare assistant still working in her NHS hospital, doing perfectly fine. So you can see that even though we're aging, it doesn't mean that we're all getting sick. However, there is a demand, a growing demand for health and social care workforce workers because, according to NHS England, the older adult admissions account for a larger proportion of hospitalisations, including emergency admissions, and this is particularly in the last year of life. So approximately 40% of all admissions account for those. As the number of people aged 85 and over is projected to double by 2045, the demand for NHS services will also increase. Therefore, in order to help reduce the NHS burden, the focus on providing more effective integrated social care is an imperative aim. So whilst we're seeing that there's more hospital admissions with older adults in hospital, of course this impacts the not so older adults and of course the children. So across all sectors of health and social care, be it for children, adolescents, young adults, older adults, and those in the last year of their life, there is an immediate need for people to join the current workforce. So there are many vacancies in adult social care across the UK, with roles available for experienced professionals and entry-level positions like care assistants and support workers. So where to find vacancies? So there's dedicated job sites such as carehome.co.uk, that's for community care, government job boards, the NHS and civil service, and specific provider websites. So if you're looking for a role in health and social care, your first aim is probably to look on a recruitment site. But don't forget that in your region, if you look on your hospital website, your main hospital or your trust's website, they will advertise jobs there. So it's worth having a look at those. Or if you are thinking about, maybe I'll start off, I'd like to work in a care home, maybe with older adults or even specialty, for example, those with dementia or mental health care that comes under health and social care, then approach your local care homes and see what they've got available and how they can help you. So there's lots of things that you can do whilst you're thinking, just by exploring all these websites and all these avenues to see what's available. Okay, could I have the next slide, please? So now we're looking at your essential skills. So what are employers looking for? So we're going to go through these in a little more detail. So I'll define empathy for you. Empathy is the ability to understand and share the feelings of another person. So it's often described as putting yourself in their shoes. Now, it's different to sympathising, because sympathy means you say, oh, I feel really sorry for you, you know, da-di-da. But empathy is actually trying to put yourself in their position. So, for example, if you have a client who you maybe were working in the community and a client's broken their leg, for example. So you're going in to help them get dressed, to, you know, make sure that they're eating, etc. So empathy would be trying to imagine what it's like to be in their shoes, to be immobile, not to be able to do the things they usually do, and to feel their embarrassment at having, you know, to be helped to get dressed, etc. So it involves recognizing and responding to another person's emotional experience from their own perspective. And that helps to build strong relationships and fosters compassion. So empathy is a key social skill that allows people to connect with one another. It understands different viewpoints. You behave in a more helpful and pro-social way. And patience and resilience is part of this. So that means not becoming anxious when things are delayed. For example, if a client is slow in getting dressed or repeats themselves several times. So this is all encompassed within empathy and compassion. It includes patience and resilience. So you have to be calm, you have to be positive. So within the care sector, in any aspect, compassion means treating people with kindness, empathy, respect, and above all, to help alleviate their suffering and build trust between you. So it involves more than just being sympathetic. It's an active response to another person's needs. Compassionate care is foundational to person-centered services. So you're fostering a sense of dignity, safety, and connection for those receiving support. So I just like to mention here, when you study, you'll probably come across what's called the 6 Cs. Now I'll just define these because they're fundamental to delivery of care. So the first C is care. So how care is delivered. It's intended to improve the quality of a client's life. We then have compassion, which we've just mentioned. It encompasses empathy, respect, kindness, and dignity. Then we have competence. So that's being able to deliver the care you're tasked with delivering. So it's having underpinning knowledge and understanding and having the right skills to deliver that care. So communication, being able to listen actively to a client or a patient. So it's not just really paying lip service to them. And to be able to work within a team, because you'll always be part of a team. So you need to communicate not just with your client or your patient, but your team. The next C is courage. So that's a strange one because you think, oh, courage, that's being brave. But in this context, it means doing the right thing. So speak up when we have concerns. And lastly, commitment. So being committed to our patients and clients and also to our team members. So as we've mentioned, communication, you need to have strong communication skills. So this means being able to communicate with patients and clients respectfully and take into account their needs and their limitations, so strengths and limitations. Likewise, being able to communicate with team members, so identifying important facts or events in a timely and concise manner. So team working might involve being part of a multidisciplinary team, and that's a wide group of professionals who from different fields who come together to discuss a patient's treatment plan. This approach allows individuals with diverse needs, perspectives, to allow all the people involved with their care to discuss what's best for them. So examples might include a cancer care team, that includes surgeons and oncologists, mental health teams, with psychiatrists and social workers. So you can see that how collaboratively this is. But within a smaller context, part of a team, you may work in a care home, but you'll still be part of a team because you may be a healthcare assistant or a care worker, and your line manager will be a senior care worker and her line manager will be the care home manager, but that's all one team. So you'll always be a part of a team, even if you work in the community on your own, visiting people, you'll still have a team. You'll have a team that support you and who you can contact. So these are very essential skills, and they're all skills that employers look for. But when you study, you will develop these skills. You probably already got some of these. You've probably got communication skills. You probably know how to be empathetic and compassionate. You probably know how to be patient. And if you're already working in any context, you'll be part of a team. So you already have these skills. So all you need to do is be able to translate these into health and social care contexts. And you'll learn this through study and through placements. So don't be worried about not having these skills. You can always write a little mind map of the skills you already have, because communication, in order to communicate, I'm communicating to you. Via the chat box, you're communicating to us. So these are all communication skills. It's just a matter of focusing them and enhancing them to be communicative within your health and social care role. Could I have the next slide, please? So this sounds a bit grand, looking at more critical competencies for success, but these are really just an add-on from the essential skills. So I'll read through my own notes here on how I define these. So it means being observant and aware These are core qualities. In addition, you need to know who and how to report concerns, and these are imperatives. In any care context, the circumstances of patient and clients can change really quickly. So you need to be able to respond to these and make changes quickly, but you will be part of a team. So there'll be flexibility, there'll be lines of reporting, there'll be management input. So your observation skills are key in looking at your client, looking at your patient, observing them, seeing what's needed, reporting on. You need to be flexible in terms of stepping in when there's a crisis. For example, if a colleague's off sick and you're asked to do extra hours or tasks, this is something that employers will look for in an employee because it demonstrates you're prepared to work as part of that team and also to work towards common aims. Now, that's not to say that if a colleague calls in sick, they'll say to you, can you do a double shift? Can you do this? Can you step in? Maybe you could say, well, I can do an extra hour, or I can help out on Wednesday. But, it's not to say these are mandatory things, but employers will look to see how flexible, how you adapt. For example, you might be a care worker in a care home and your senior care worker is off sick, or they may be on a course, and you might be asked to step up into their position for the time that they're away, if you have the skills. But think about your adaptability here, because if you step up to a senior role, that's going to help you learn new skills, be able to work in a higher position up the team, and it'll help you if you want to move up the line of progression. Good time management. Well, this is essential in any role. You will also need the ability to write clear records and even possibly reports. You'll meet clients and patients from different backgrounds and cultures, so no matter what their race, ethnicity, religion, etc., you will be expected to observe person-centered principles and treat everyone with parity. So that means you treat everybody the same, no matter how they are, what their disabilities might be, where they come from, their religious backgrounds, etc. You treat them all the same. Within a care role, you'll also have predetermined boundaries. This is important. So these relate to which qualification, experience and job role you have. However, you need to realise that it's important you demonstrate initiative within any of your roles. So you'll have a remit and it'll be well defined. So, for example, if you're a healthcare assistant working in a GP practice, you'll have a really clearly defined role. But within that role, there is scope for you using your initiative. And for example, if you're concerned about a patient, you may be just asked to do a simple check on their blood pressure, their pulse, their heart rate, weigh them. And that might be all you're asked to do. But you will be expected to use your initiative. So for example, if I'll give you a scenario here, a client comes in for a simple check, they need to have their blood pressure done. Their blood pressure is fine, but you might notice that they are perhaps a bit hot, they might be a bit disorientated. So using your initiative, you would actually call for somebody else, so the practice nurse or even a GP, to come in and look at the patient for you. You wouldn't just ignore it or note it down and leave it in the tray. You would actually use your initiative. Now that's working outside your remit, but you're showing that you have initiative because you've recognised that, hey, this person who's come just to have a routine check for their blood pressure is not looking so good. So I'm going to alert somebody to this, and I'm not going to leave them on their own. I'm going to get somebody to come in. So you can see how, all these things will help to build your experience, to build your skills, and to allow you the scope to progress up that career ladder. Could I have the next slide, please? So we're talking here about your CV. So CVs are can be quite difficult to compile, but there are many helpful websites to help you do this. Have a look at some online. Even the recruitment sites have information on how to structure your CV. So I've written some notes on this and some things you need to consider. So first of all, read the job description and person specification. So if you look on a recruitment site, first of all, you'll see the job, and then usually in smaller letters underneath the job description, you'll see person specification. So open it up and make sure you read it, download it, because it will tell you more details about the role. So where possible as well, familiarise yourself with the company or the care home. Most will have websites. So if you're applying for a job or you're interested in a job, it usually, even recruitment agencies, it will usually give you the name of the company. So look them up online, have a look around their website, see what their mission statements are. Just familiarise yourself with them. So be prepared, get your qualifications, write a good CV. As I've said, look online for CV writing sites to help you. Within the CV, highlight your skills, your strengths and experience. So don't be afraid to actually lay out your skills and experience. This is what employers look at in your CV, but make sure that they are correct. If you've not worked before in the care sector, highlight informal experience you might have that's relevant to the position you're applying for. So this means you may need to tweak your CV now and again. So don't just have one CV that you send out to everybody. First of all, when you're applying for a job, pull up your CV and look at the job specification, because you may need to just alter a few things within your CV to tailor it to that position. That's not to say you're making things up. You're just focusing on different things, perhaps. So, for example, if you're applying for a role as a care assistant within a residential care home, but have not had any formal experience, but you have achieved your level 2 certificate in adult care, you will want to highlight the formal qualification and then perhaps explain you have had experience in informally caring for perhaps an elderly relative or caring for a relative recovering from major surgery, etc. So before you say, oh, I can't apply for that job, I don't have any experience, think about what experience you do have. You may even have looked after a sick sibling, or your mum or your dad might have been unwell and you've helped look after them. These are all informal caring roles that you can draw on and put within your CV. Highlight interpersonal skills, so don't be afraid to say something like, I have excellent communication skills, I'm empathetic and caring. So remember, at interview you might be asked for a specific example. For instance, they may say to you, tell me about a time when you assisted an elderly relative, client, patient who had mobility problems. So what they would do here is they would draw on your CV. So if you said you'd helped care for an elderly relative, or you've had some experience and you've cared for a client, they will draw on that and they'll note that. If you haven't had any formal experience, they will change that question to say, well, tell me about the time that you looked after your mum when she was ill. And they'll expect you to just, tell them. If you're unsure about the question, say so. So you could say to them, if they just say, tell me about a time when you looked after an elderly client, you could say, could you tell me what sort of things you'd like to hear? Do you want, and ask them to clarify the question. Don't be afraid to come forward and ask, because that actually shows them you have communication skills. You've got good communication skills. You're questioning. You don't want to just think, I'm not sure what they're saying, so I'll just launch into this account. Ask them to clarify. Obtain a list of people who would be prepared to provide you with a reference. Volunteer placements are excellent for this. Previous employers, personal character references, schools and colleges. can usually only provide you with dates of study, but these are useful too. So if you've not worked before at all, then think about people who might be able to provide you with a reference. You might have volunteered in a place only once, but you can still ask them for a reference. If you've done some casual work anywhere, ask for a reference. Personal references, as long as they're not family, you can ask for a personal reference and just compile a list. And before you put their name on your application, make sure that you contact them and say, ask for consent. So you ask them, is it okay if I put you down for a reference? I've applied for this position. Can I give them your details? Now, you can also say to an employer, prospective employer, they usually have, when you do a formal application, it usually says at the bottom that you need X amount of references. Can we approach these referees prior to interview if you're successful? Now, if you're already working, you may like to decline that and say you can apply for them once I've been offered the position, because obviously what you don't want to do is, if you're already employed, you don't want your prospective new employers to be asking for references in case you don't get the job, because then your employers will know you're looking for a job. So you need to be a bit careful in that regard. So it's perfectly acceptable to say no. If I'm offered the position, then I'm happy for you to contact these referees, because you can be offered a position subject to references. That's how that works. So these are all just little things to remember. Could I have the next slide, please? So we've gone through a lot of these within the previous discussion, but I'll reiterate, the slide is very clear. So list your roles in reverse order, that's very important. Everything needs to be chronological, but keep it short. Ideally, you want to be looking at keeping your CV really to a couple of pages, and the first page would be headed up with your details. Make it really clear. You might like to put it in the middle in a different colour. Your contact details, your email address, your mobile phone number, and then you would start with your qualifications. Normally come first, the qualifications listed in chronological order, then your work experience, then you'd have a section on your relevant skills where you would summarise the skills you have and what your experience is, and references we've dealt with that. Keep those aside until you know, you can put them down. If you've never worked before, that's fine. If your present employer might know you're looking for another job, just ask them, say, look, I'm looking for a job. You may be working, I don't know, in a shop, for example, and you want to transfer into health and social care, and say, I'm looking to work in health and social care. I'm applying for a few jobs. Can I put your name down as a referee? So make sure that it's all very transparent. So as I've told you, the referees, you have a right for the prospective employer not to contact referees unless you've had an interview. So just remember these sort of little tips. That's one important point. Nowadays, employers don't always take up references, but they work on a probationary period. So if you've never worked, gaining referees shouldn't prohibit you from applying for a position. But as I said, you could get a character reference. But it's very variable nowadays whether prospective employers will actually take up references. Sometimes they'd sooner work on interview technique, how you interview. They may actually give you, when I say a test, they may ask you to sit a written test. So they might give you a scenario. For example, you're in this care context. Your role is, how would you approach a patient who? And they might say, right, we'll log off for 10 minutes. If you could just read the scenario, write your answer, and then we'll log back on after 10 minutes. So that's quite a favoured way of interviewing now. And then, of course, if they offer you the job and they don't take up references, they may say to you, we're offering you the position subject to a probationary period of, might be 1 month, 2 months, 3 months. So these are all different ways that employers work. So just be aware of that. You can ask that at interview as well. Will you be taking up references if I'm offered the position? So don't be afraid to ask. Could I have the next slide, please? I've just missed one section of that, which is, I'll go through now, the previous slide, volunteering. Volunteering, thank you, is an excellent way to gain introductions into the care context. So volunteer roles provide you with experience and an overview of what it's like to work in various settings. So, for example, you might volunteer in a care home or in a residential school for children with autism or anything. You may volunteer in a hospice, or you might be a volunteer within an online support group. I mean, Samaritans or Age UK or Mind, or there's an array of them. These are all volunteer positions. So if you volunteer, remember that this is valuable experience and it's really good to put on your CV. Doesn't matter how many hours you do, it's worthwhile. So think about, if you don't already have any volunteering experience, think about perhaps approaching some organisations, or even in your own, if you live in a village or a town, usually there are community outreaches going on. So you could approach those, even in local places like churches or mosques or anywhere that people gather. There's normally volunteer opportunities. So think about it. And it doesn't have to be absolutely aligned with health and social care. What you're showing is that if you volunteer for something, you're showing that you have communication skills, you're adaptable, you're flexible, and you're committed and you're willing to learn. So thank you. Can we move on to the next slide? Thank you. So workplace opportunities. So I'm just going to read this slide for you because with South London College, on many of their courses, they will provide you with placements. And placements are such great opportunities for actually working within the context that you're studying for. So it gives you real world insight and exposure to care environments and what it's actually like to work with people. You will gain hands-on experience and knowledge. So if you're in a work placement, don't think that people will ignore you or give you menial tasks. They know you're there to learn and they will make use of that. They will give you some invaluable training. And also placements help you gain employability, because on your CV, when an employer sees that you have had a work placement, of course, that flags up, yes, this person has already had some experience. And also it might open a door to a role within the context that you're having your placement in. So the work placements provided by the college will be outlined within the study outline of the course that you're going to take on, and they'll arrange it for you. So could I have the next slide, please? So now we're talking about qualifications. So the slide itself is informative, so I'm not going to just read through it, but I'll just go over some of the roles. So for example, entry level roles, these are level 2 roles, and their foundation study. So level 2 roles are things like care assistant, healthcare assistant, support worker. The involvement is in direct and personal assistance with clients or patients. So we've all seen health care assistants in a hospital setting or a GP surgery. You may have been out and about shopping, or maybe in your local GP surgery, dentist, or just having a coffee, and you've seen a support worker with their client, taking them out, helping them to do their shopping, helping them to go to the bank. They may have taken them to the GP, so they're helping to develop their skills. They don't actually do the things for the client, but think when you're out and about, look for these. It's quite easy to see, because once you're focused on, you say, oh, that's a support worker. Senior care workers, so these would be for level 3. So their responsibilities are involved with developing and monitoring care plans, overseeing shifts, responding to emergencies, communicating with families and residents. The role requires you to undertake administrative duties like record keeping, medication administration, as well as creating engaging activities for residents. And also at level 3, within your professional capacity, you will probably have a team of care workers or care assistants who are at level 2. So as you can see, you've got example courses here that you can undertake for each level. So now we're going to move on, the team leader. So this might be level 4 or level 5, so there's a crossover. So I'm going to cover a care manager here as an example. Now, a care manager could be level 4, could be level 5, and they oversee care settings, overall operations. It includes strategy, budgets, quality of care. A team leader, on the other hand, focuses on the day-to-day guidance and support of care staff within that setting. So, for example, within a care home, because that's very clearly defined, you will have a team leader who will probably have an advanced practice certificate. So she'll be in charge of the senior care worker and all the care workers underneath that. So that's the hierarchy there. And when the care home manager is not there, so she may be on leave, it may be her days off, or she may be elsewhere, they will step into that role. So very often you will find a team leader will have a level 5 qualification as well. But certainly if you were in a care manager position, you would need a level 5 diploma in management or similar to enable you to undertake that role. So all these qualifications, you can see level 2, 3, 4, 5, and so it goes on. And after level 5, you may think, well, I'm okay with this. I've done all this. I've done all my study at these levels. I've been through these roles. But you know what? I think I might like to progress now. I might even want to go into nurse training. So as you can see, having all this experience and you've done all this study and these qualifications might lead you into higher education, because it's all prior learning, and you may say, well, I'd like to do a degree in nursing. So that would be at university. But you can see the progression doesn't end with level 5. It can go on and on and on. So it prepares you for a higher education, if you like, and it gives you a good grounding, prior knowledge, experience to inhabit that role. And you may find that you, in a lot of higher education programs, you will have recognition of prior learning or accreditation of prior learning. So these are all things to consider if in the future you think you might want to go. You might even want to jump into social work, for example, which is the same. It's a higher education. So these are all things to think about when you're starting out or when you're boosting your qualifications. Could I have the next slide, please? So, interviews. So these are, I'm not going to read the slide for you because it's there, but I will, I've made some notes on this slide and I'll go through them for you. So we've spoken about before, research the organisation thoroughly. It's a good starting place, and you'll find out various things. You might even find the person who's interviewing, find details about them on your site. So if you're going for a role in a care home and you look up the care home online, it will have the name of the care home manager and probably some of the senior staff, so you can familiarise yourself with those and write them down so you're prepared when you go for interview. So what do you know about the organisation? Find out, because these are things that you can bring in to your interview. You might say, it might come up that you can say, well, yes, actually, I looked on your website and I saw that you XYZ, and I understand that you provide XYZ, etc. So you're showing that you've conducted some research. So we've already spoken about some of the types of questions you might be asked. And here it talks about the STAR method, and this is most often used, and you'll see now how this comes into it. So it's situation, task, action, and result. So the interviewer will give you a specific scenario and ask you to either provide an experiential example or hypothetical one. So that's an important point, because if you're asked an interview question about a scenario and you've never encountered a scenario, then think about a hypothetical one. So when you're preparing for an interview, think about scenarios that you may be asked and write some hypothetical scenarios and work through them yourself so that you're familiar. So when they ask you a scenario that you've not encountered, you can say, well, I haven't directly encountered, I haven't had that experience, but if I were to encounter that experience, here's how I might approach it. So you can see how you're telling them that you've thought about it, you've done a bit of research, and you've actually thought about some hypothetical scenarios. So, that's a good point. If you research online, there's lots of mock videos of interviews on YouTube. So if you just go to YouTube and type in mock interviews, you can put health and social care. It just gives you an idea if you've never been for an interview, because they can be quite stressful. Most are conducted online now, so that's it's still stressful, but it's sort of less stressful than having to go to a place, sitting in a waiting room, waiting and waiting and waiting, because that can be very can make you quite anxious. But if you're in your own home and you've just got to log on at a certain time, that can reduce your stress levels. But more and more employers are interviewing online. But be prepared. Make sure, even if it's face-to-face or online, you're there, you're ready, you're logged in, ready. 10 minutes early, you can just sit logged in, waiting. What you don't want is for them to log in before you. Interviewers will normally log on right at the last point, so in the last minute before the interview. They'll be wanting to see if you've already logged on. So remember that. Dress smartly, so make sure you're not in your pajamas. Have all your documents ready beside you. So yes, you've probably already uploaded them, sent them to this interviewing panel, but you want to make sure you've got them with you, your CV and your certificate. So if you need to refer to them, they may say to you, on your CV you've made a note of XYZ, could you tell us a bit more about that? So you can then say to them, just a moment, I've got my CV here, I'll look at that point, and you can look at it, and then you can say, yes, I'll tell you about it. So, that's all good communication. And be sure that you use a positive posture and body language. That's not to say you have to sit stock still, because you know that I use lots of gestures and I'm not still and I'm moving about, because these are all good communication, non-verbal skills. So things to remember. So if you're face-to-face as you walk in the door at interview, or yes, I've done that, but they will log on first. First impressions are really important. So that's why I say be smiley, be pleasant, be communicative. If you don't understand something, ask. And when you first log on, and the interviewer will probably say to you, oh, hello. So if it's me, they would say, hello, Sandie, nice to meet you. And you would say, yes, I'm really happy to be here. Thank you for providing me with the opportunity to interview for this role. Start off with something like that. And these are little introductions that you can practice at home. If you're used to interviews, then you might not need to do this. But if you've got some stock standard responses that you've practiced, it will reduce your anxiety levels. And you could even have these. So if you notice, I've got, it's blank, but I've got some paper here beside me and a pencil should I need to write anything down. But you could easily have within your eye line a couple of scenarios and opening statements, so that you can just glance. If you forget and you think, I'm so stressed, I can't think, my mind's gone blank, you could just glance across and say, all right, yeah, I remember now. So these are all preparation things. And also do a mock interview with somebody that you know. Say to them, look, I've got this interview on Monday and I'm really nervous about it. You know, it's just my mind keeps going a blank. This is the role, this is my CV, this is what I've sent them, this is the person specification. Could you just do a pretend interview with me and practice it? And you'll find that once you've gone through that process, it will help you reduce your anxiety levels. So could I have the next slide, please? I think that's me done for the moment. We can't hear you. Your microphone's switched off. That's
Thank you
better.
very much. I hope everyone can hear me.
Yes, we can now.
Thank you so much, Dr. Bowden, for that wonderful insight. And I hope all of our audience here has been writing down or taking notes. These are very vital, important notes if you all are planning to follow a career in the care sector itself. Now we're coming towards the end of our main content. But before we move to your questions, I would like to make sure you don't miss out something exclusive we have prepared just for today's attendees. As a thank you for joining us today and investing your time in learning about this career path, we are offering you a £50 off any adult care course with South London College. So actually, basically how it works, let me provide you the procedures. So when you are ready to enroll, just use the code webinar, which is WEBINAR at checkout. So the moment you purchase a course and the moment you enter into the checkout phase, you just enter the code webinar, and then from there you will be obtaining the £50 discount. Now, this is a limited time offer. You have only 7 days. From the time of the webinar towards 7 days, this discount only will be valid. So ensure that you quickly book this for yourself in order to obtain this valid discount. So if you are serious about starting your career in adult social care or taking it to the next level, now is generally the perfect time to act. £50, yes, might not sound huge, but it's our way of saying thank you for being here, especially with a great expert also who is in the field, and then to provide you all of that insight, golden information. We want to make it also accessible as possible for you to start this journey. Now we also have another fantastic offer I want to mention quickly, which is the buy one, get one free promotion. When you enroll onto one of our adult care courses, you can select an additional course from our catalog at no extra cost, right? Multiple qualifications make you significantly more attractive to employers and open doors to a wide range of opportunities or positions. And remember that the free work placement we talked about worth £149, that's included automatically in the enrollment itself, right? So just to give you a full summary of what the package will actually be. So you will actually having a £50 off with the webinar code, a second course completely for free, a free work placement worth £149, full tutor support throughout your studies, a recognized industry relevant qualification. This is generally exceptional value, and it's designed to remove barriers and help you succeed and achieve your career goal. So if you like to explore our health and social care courses right now, you can visit our website, that is southlondoncollege.org/course/health and social care/adult care. We'll also send you an email after today's webinar with all of these details and discount code. So you don't need to worry about writing it down again. Right? Any questions about enrollment, course duration, payment plans, or even fee structuring, you're welcome to email us at inquiry@southlondoncollege.org. And our team will actually be delighted to help you. Right now, it's time for the question and answer session. So this is where many of the participants who are actually are curious about to get more information about the course and all can actually freely provide the questions here itself. So before we move towards, there has been actually two questions asked from our attendees here. So the first question is, do you need to get from level 2, 3, 4, and then 5, or can you go to level 5 with past experience in other sectors? So I hope this will be a good question to our expert, Dr. Sandie. So if you can provide us this answer for this question, Dr. Sandie, it's over to you. I mean, one of our attendees is asking.
It's a great question, and particularly for adults, because most of us looking to change careers have some form of work experience. We may even have, GCSEs, A levels, etc. So my advice would be, well, you would have to look at the course curriculum first of all and see what it entails, and understand whether you have the previous academic, particularly for a level 5 course, because level 5 is equivalent to the first year undergraduate study. So do you have the commensurate academic skills to jump straight into a level 5 course? Does the course allow you to do it? Because many courses won't. They will want previous experience at level 4 or 3. So it depends on the provider, but it also depends on your skills and your knowledge, etc. Because a level 5 course, for example, level 5 in health and social care management, will make assumptions that you have all the knowledge from 2, 3, and 4 to go to level 5. So it won't cover all that previous knowledge. It may skip over a few things, but there will be assumptions that you know all those things that you would have learnt before. But if you've worked in health and social care for many years, you may have that knowledge. You may have completed lots of workshops, lots of training days, certificated CPD, etc. But it's for you to explore the course, talk to the provider, and see whether your existing skills are commensurate with you jumping in at that level.
Yes, that's great. So I hope that question has been answered. So we have another question here as well, which is again requested from one of our participants. I'm already a parent care. Is there any exclusive fee structure or future course? So that one will actually have to be spoken with our course advisors. We have the course advisors, so actually they'll communicate with you and provide you the necessary information for that. So our next question here is: do we have the course? Field for each of the levels, and are there any grants, mode, or support? Also, how long each course will last, and last but not the least, can this be all online? So of course, again, our course advisors will actually contact you and provide all of the information. And I hope then all of these information or clarity that you all are having would be cleared out. So let's move on to some of the questions that has been asked by our attendees as well. So one of the questions that has been asked by our pre-attendees has asked, our first question comes from actually Sarah, who says, I have absolutely no experience in care whatsoever. I have worked in retail for the past 10 years. Is it realistic for me to break into this sector? And where should I start? Do I need qualifications before I can even apply for jobs, or can I start working while I study? So, Miss Dr. Sandie, what about? I
Um,
would like to give this question to you as well.
yeah, this was partially covered in one of the early slides, in that you can apply for a role in care if that's what you would think you would like to do. Obviously, it would be an entry level role, and again, it would be for your prospective employer to say, they will either say on the job specification, we require you to have a minimum level 2 qualification. It will be very clear on the specification, or it will say no experience required. It will say that, or they may say yes, we'll allow you to apply for the job as long as you combine your study alongside your work. So there's different options, and it's really all down to the employer. So it would be for you to approach, if you look at the job you want to apply for, to see what their requirements are, because in the job specification it will have a whole list, and it will say experience, it will either say not essential or essential, qualifications essential, and it will list them, or not essential or working towards. So the person specification will give you all of that information, and if you're not sure and you want to apply for a role, then contact the employer and say, I haven't any experience, but I'm really keen on, I really want to apply for this role. What do you think? Ask them. But having a basic qualification, if you've never worked in care, level 2, will also, it increases your employability, but it will also give you an idea of whether it's right for you. So even if you decide you do the level 2 course, no, it's not for me, you've still got that level 2 course in health and social care. It's always going to be there. So you can always then, if you decide, no, in a couple of years, no, I do want to give it a go, you can apply, or it's on your CV for whatever job you want to go for next. So it's never going to be wasted. But normally employers, even if you get a role without any qualification, they will want you to be studying for a qualification whilst you're working, because there's a lot of, when I say competition within the care sector, if you don't have any qualifications and you don't study, then your scope for progressing from basic entry level role is going to be limited.
Thank you very much, Dr. Sandie, for that. I hope anyone who had an issue regarding that question I hope it has sorted out. One more last question. After that, we can wind up the webinar. So one more question is, so one of our participants again has requested, that is actually from Priya, who writes, I did some informal care for my grandmother a few years ago, but nothing professional. I am nervous about things like manual handling and personal care. These feel quite intimidating. How much training and support do you get before you are expected to do these tasks independently? And what if I make a mistake? So, Dr. Sandie,
What
this
a
question is
great,
again over to you.
that's a fantastic question, and I'm so glad
Yeah.
that it's been asked. First of all, the care that you delivered with your grandmother is going to be invaluable, and my advice would be to take some time, even if it's half an hour, and write down exactly what you did, what was your experience, or you could even record it on your phone. document it that way, but document it so you revisit it, because we often forget what we did, and think back, close your eyes and think back, what did I do, how did I do it, da da da. So that's that, and that's there for you for when you apply for a role. Now if you get a, so supposing you're doing your level 2 study, you're doing the course, and you learn all the theory, safeguarding, you learn all about person-centered care, you'll learn the theory behind delivering care to a patient, and there you go, you've got a job as a care worker. You're in a care context, and you're faced with real live patients. And yes, it can be really intimidating, because you think, oh my goodness, that was the theory, but now I'm actually here. It's so scary. But you needn't be worried, because people will know that you will be assigned a mentor or a team leader or a work buddy. You won't be on your own, and you won't be allowed to move a patient, lift them, get them out of a chair into a bed, or from a wheelchair, into a bed, or transfer patients, or you won't be asked to bathe a patient or do anything if you haven't had experience. There will always be somebody there with you, because it's part of the training. Once you enter a care role, you will find you have things like manual handling training, you'll have medication training, you'll even be trained on how to take a temperature properly. So don't be worried that you'll just be thrown in at the deep end, walk in through the door and I say, there you go, because it won't happen. So no, lower your anxiety about it. You will be mentored, you will be trained, you will be guided through everything. And supposing you're in a context and they're really busy and they say, oh, can you just go and do that? You've got to be able to communicate and say, I would love to do it, but I've never been shown how to do it. Could someone please come with me? Could somebody show me how to do it? Or you may have done it once, but you're not confident. And you may say, yes, I did it last week once, but I'm really not confident. I'd just like somebody there with me to watch me. And that's how you learn, and that's how you build your confidence. So don't be afraid to ask, but you won't be left on your own. And if you undertake a course with a placement, of course, you will be mentored all the way through the placement, and you won't be left on your own at all, because it's part of your training. So I hope that was a brilliant question. Wonderful question.
So I hope that actually clarifies your doubt. And before we wind up the session, we would first like to thank all of our participants who had actually entered to this webinar, and also our guest as well, Dr. Sandie Bowden. Thank you very much for allocating your precious time to attend this webinar itself. And for the next webinar itself, if we have, we'll actually update you as well through our SLC webinar. And any webinars that are coming in future will actually update you. And yes, basically for today, we would like to wind up the session, and then hope you all have a great day. Thank you very much.
Bye, everyone.